Ever feel like you're running on overdrive? Like you've had 5 cups of coffee but haven't slept in days?
Oh, yeah?
That's kind of what it's like to live with hyperthyroidism.
Yeah.
You've sent us some fascinating medical articles or websites on the topic, so today we're taking a deep dive into this condition.
It's a surprisingly common issue,
Yeah,
and the effects can be far-reaching.
right.
It all centers around your thyroid, that little butterfly-shaped gland in your neck.
Okay. I know the thyroid is important, but remind me, what exactly does it do?
It's basically your body's control panel for energy use. Think of it as the gas pedal for your metabolism.
Uh-huh.
It impacts almost every organ, from your heart rate to how efficiently you burn calories. And in hyperthyroidism, the gas pedal gets stuck.
Everything speeds up.
Yeah.
And according to these articles, about 1.2% of Americans have hyperthyroidism. That's millions of people dealing with this pedal to the metal situation.
Yeah.
No wonder the list of potential symptoms is so long.
It is a wide range.
Yeah.
Some are subtle, but others can be quite dramatic.
The articles mention rapid heartbeat, nervousness, sweating, even weight loss despite increased appetite. Some of these sound like they could be mistaken for just being stressed or having a busy week.
Exactly. That's why it's so crucial to see a doctor if you experience any of these symptoms. Early diagnosis is key to managing hyperthyroidism effectively.
Makes sense. Now let's get to the root of the problem. What actually causes this thyroid overdrive in the first place?
Well, there are several possibilities, but the most common culprit responsible for up to 80% of cases is Graves' disease.
Graves' disease, that name sounds pretty serious. What's going on there?
Imagine your immune system as a security guard, protecting your body from invaders.
Okay.
In Graves' disease, this guard gets confused and starts attacking your thyroid gland. It's like friendly fire, and this attack causes your thyroid to produce way too much hormone.
So it's an autoimmune disease, like the body is fighting itself.
Exactly.
And the articles mention it can run in families. Is that because of this immune system confusion?
Genetics definitely play a role, but it's not just Graves' disease.
Okay.
We also see cases where lumps or nodules in the thyroid start overproducing hormones, essentially turning into tiny rogue hormone factories.
A rogue hormone factory in your neck? That's a pretty vivid image.
Yeah.
Some sources also mention that consuming too much iodine can contribute to hyperthyroidism.
Right.
But isn't iodine supposed to be good for the thyroid?
It is in the right amounts. Think of it like this. Your thyroid needs iodine to make those hormones, like a baker needs flour to make bread. But if you give the baker way too much flour, the bread won't turn out right. Too much iodine can throw off that delicate balance.
So how do doctors know for sure if someone has hyperthyroidism? Is it just based on these symptoms we've been discussing, or are there specific tests?
Symptoms are certainly clues, but we need hard evidence to confirm the diagnosis.
Right.
That's where blood tests come in. We measure the levels of certain hormones like TSH, T3, and T4.
Okay, a lot of letters there. Well, what are those exactly? Break it down for me.
Think of TSH as the signal from your brain telling your thyroid how much hormone to produce.
Okay.
T3 and T4 are the actual hormones your thyroid makes, the ones that have that gas pedal effect on your metabolism.
So by looking at these levels, doctors can see if the thyroid is getting the wrong instructions or producing too much of the fuel that speeds things up.
Exactly. And if Graves' disease is suspected, there's a special antibody blood test that can detect the presence of those confused immune system guards attacking the thyroid.
The sources also mentioned imaging tests like radioactive iodine uptake scans and ultrasounds. What are those for?
These tests provide a visual look at the thyroid itself.
Okay.
The radioactive iodine uptake scan, for example, shows how much iodine your thyroid is absorbing, giving us a sense of how active it is. The ultrasound allows us to see the structure of the thyroid, checking for any nodules or abnormalities.
So it's like putting together a puzzle. You've got the blood work showing hormone levels and then the imaging showing what's happening in the thyroid itself.
Precisely. And once we have all the pieces, we can determine the best course of action. The good news is that hyperthyroidism is treatable, but the approach depends on the underlying cause and severity.
Well, that's a great lead into our next section. Let's dive into those treatment options. What are the main approaches doctors consider?
When it comes to treating hyperthyroidism, it's not a one-size-fits-all approach.
Right.
It's more like tailoring a suit.
Yeah.
We need to consider the individual's specific situation, the cause of their hyperthyroidism, the severity of their symptoms, and their overall health.
So it's really about personalized medicine, finding the right fit for each person. The articles mention a few main treatment options: antithyroid medications, radioactive iodine therapy, and surgery.
Right.
Let's break those down.
Antithyroid medications are often the first line of defense.
Okay.
They work by blocking the thyroid's ability to produce excess hormones. It's like turning down the volume on that overactive gland.
So instead of the gas pedal being stuck to the floor, it's more like easing off a bit. But I imagine there are different types of antithyroid medications, right?
There are, and each has its own nuances.
Okay.
Methimazole and propylthyrosol are two commonly used options. They both aim to reduce hormone production, but they have different safety profiles, particularly for pregnant women.
Ah, that's where those details about specific medications during pregnancy come in. It sounds like choosing the right medication is a bit more complex than just picking something off a shelf.
It is, and that's why working closely with a doctor is so crucial. They can help navigate those complexities and choose the medication that's most appropriate for your individual circumstances.
Okay, so we've got medications that essentially try to tame the thyroid. What about radioactive iodine therapy? The sources mention it actually destroys thyroid cells. That sounds pretty intense.
It is, but it's also highly effective. Essentially, we give the patient a small dose of radioactive iodine, which is absorbed by the thyroid. Those overactive thyroid cells, the ones causing all the trouble, soak up this iodine, and, well, they don't like radiation very much. The radiation destroys those cells, effectively shrinking the thyroid and reducing hormone production.
So it's like a targeted strike against those rogue hormone factories?
Yeah.
But the articles also mention that radioactive iodine treatment usually leads to hypothyroidism down the road. What's that about?
You're right. Because we're destroying those overactive cells, the thyroid often ends up producing too little hormone, which is hypothyroidism. It's essentially the opposite of hyperthyroidism, where things slow down instead of speeding up.
So it's like swinging from one extreme to the other. But I remember reading that hypothyroidism is generally easier to manage than hyperthyroidism.
Exactly. It's often a trade-off that people are willing to make to get their thyroid under control. Hypothyroidism is typically managed with daily medication that replaces the missing thyroid hormone.
It sounds like managing a thyroid condition, whether it's hyper or hypo, can be a lifelong commitment.
It often is, and that's where regular monitoring and checkups become so important.
Speaking of monitoring, I noticed the sources emphasize that regardless of the treatment, it's not a set it and forget it situation. There's a lot of ongoing fine-tuning involved.
Absolutely. With medications, for example, we often need to adjust the dosage over time based on blood test results. And even after radioactive iodine or surgery, regular monitoring is essential to make sure the thyroid hormone levels are stable.
It's about finding that sweet spot, that balance where the thyroid is functioning just right. And it sounds like it can take time and patience to get there.
It certainly can. And sometimes it involves a bit of trial and error to find what works best for each person.
We've talked about medications and radioactive iodine, but what about surgery? When does that come into play?
Surgery, which involves removing part or all of the thyroid gland, is typically reserved for specific situations. For example, if someone has a large goiter that's causing discomfort, or pressing on other structures in the next surgery might be recommended.
So it's not the first-line treatment, but it's an option when other approaches haven't been successful or there are additional complications.
Exactly. And like any surgery, it carries its own set of risks and benefits that need to be carefully considered.
You know, as we're discussing all these medical details, I can't help but think about the person behind the diagnosis. Hyperthyroidism isn't just about numbers on a blood test. It's about a human being experiencing these symptoms and navigating the challenges of treatment.
You've hit on a crucial point. We've focused a lot on the science of hyperthyroidism, but the human side of this condition is equally important. Living with hyperthyroidism can be emotionally and socially challenging, and it's something we need to address.
That's a perfect segue to our next section. Let's shift gears and explore the often overlooked emotional and social aspects of hyperthyroidism. We've covered the nuts and bolts of what hyperthyroidism is, how it's diagnosed, and the treatments available. But now I'm really curious to explore what it's actually like to live with this condition.
It's a great point. We can talk about hormone levels and medications all day, but that doesn't capture the full experience. The sources you shared actually highlighted support groups and online forums as valuable resources, which speaks volumes.
That makes sense. It's one thing to understand the medical side of things, but it's another to deal with the day-to-day reality of hyperthyroidism.
Exactly. Sharing your experiences, frustrations, and even victories with others who truly get it can be incredibly validating and empowering.
It's like finding your people right. Those who understand what it means to suddenly feel like your internal engine is redlining.
Precisely. And these connections can also provide practical support. Tips on managing symptoms, advice on navigating the healthcare system, maybe even recommendations for good endocrinologists in their area. It's a wealth of shared knowledge.
Beyond connecting with others who have hyperthyroidism, I imagine it's crucial to educate friends and family about what's going on too.
Absolutely, because let's be honest, some of the symptoms like mood swings, irritability, and anxiety can impact relationships.
It's not always easy to explain why you're suddenly snapping at someone or feeling overwhelmed by things that never bothered you before.
Having those open conversations with loved ones can make a world of difference. It allows them to offer support and understanding rather than judgment.
And it can help them recognize when you might be struggling and encourage you to seek additional help if needed.
Because sometimes managing the emotional and psychological burden of hyperthyroidism requires more than just the support of friends and family.
That's where therapy can be invaluable. Talking to a professional can provide tools to cope with the challenges of living with a chronic illness like this.
A therapist can also guide you in managing stress, which is a known trigger for hyperthyroidism flare-ups.
There's a lot of buzz around mindfulness and stress reduction techniques like meditation or yoga. Could those be beneficial for someone with hyperthyroidism too?
Absolutely. These practices can help individuals regain a sense of control over their body and emotions, which can feel elusive when dealing with the ups and downs of a thyroid condition.
It seems like it's about taking a holistic approach, treating the whole person, not just the symptoms.
Exactly, and recognizing that each individual's journey with hyperthyroidism is unique. There's no one-size-fits-all experience or solution.
Some people might find their hyperthyroidism goes into remission with medication and eventually they don't need it anymore. Others might require lifelong treatment, whether it's medication, radioactive iodine, or surgery.
And some may experience complications like those eye issues we discussed, which require their own set of treatments and support.
It's a lot to navigate, and having a strong support system can make all the difference.
And remember, you're not alone. Millions of people worldwide live with hyperthyroidism. There are countless resources out there, from online communities to local support groups dedicated to helping people navigate this condition.
Well, I feel like we've really taken a comprehensive deep dive today. We explored the medical complexities of hyperthyroidism, from causes and symptoms to diagnosis and treatment options. But we also went beyond that, delving into the often overlooked emotional and social aspects, highlighting the importance of support self-care and finding your community.
It's been a fascinating exploration. I hope our listener feels more informed and empowered to take an active role in managing their health.
If there's one key takeaway, it's that knowledge is power. The more you understand about hyperthyroidism, the better equipped you'll be to advocate for yourself, make informed decisions about your care, and live a full and meaningful life.
And remember, we're always here to help you dive deeper into any of these topics. Just let us know.
That's it for today's deep dive. Thanks for joining us.